GLP-1 medications are everywhere. You probably know someone who is taking one, or maybe you've considered taking a GLP-1 yourself. At the very least, I'm sure you've seen the many advertisements for them. We've all seen the rapid weight loss, but what's the catch? Why are GLP-1s so popular? What are the side effects? What happens if you take one, and then what happens when you stop? And how do you know if taking a GLP-1 is something you should consider? Welcome to Nutrition Nuance with Dietitian Ann, the podcast where you'll get a direct answer to the nutrition question of the day in the first 5 minutes. We'll spend the rest of the episode unpacking the science and how it applies to your real life. I'm your host, Ann Kent. I'm a registered dietitian, a certified diabetes educator, and intuitive eating counselor with a master's degree in nutrition. My goal isn't just to give you answers, it's to equip you with the tools to understand and apply nutrition concepts to your life, honoring your autonomy as the expert of your own body. Let's answer today's question. A quick trigger warning before we start today's episode. We will be talking about weight, body composition, and body dysmorphia. I won't be promoting weight loss, but this topic may be triggering if you have a history of eating disorder, body dysmorphia, or are working towards making peace with food. There are a lot of opinions and misinformation about GLP-1s right now. Today, I want to offer you a thoughtful, kind, judgment-free conversation because I believe in informed consent when it comes to GLP-1 therapy. Only you and your qualified healthcare team can make a decision about which medications are right for you. Let's start our conversation about GLP-1 medication with the foundational question. What are GLP-1s? There are actually two classes of medications that are often lumped together in this discussion, GLP-1 receptor agonists and GIP receptor agonists. GLP-1 and GIP are both natural hormones produced by cells in the small intestine. They stand for glucagon-like peptide 1 and gastric inhibitory peptide. These hormones stimulate their respective receptors, which are located all around the body and are what trigger the physiological response to the hormone. The medication version of these hormones trigger a stronger and longer lasting response in these receptors, so they have a bigger physiological impact than the natural hormones. A few popular GLP-1 medications you've probably heard of include semaglutide, which goes by Ozempic for type 2 diabetes, Wegovy or Rybelsus for weight loss, liraglutide, which goes by Victoza for type 2 diabetes, and Saxenda for weight loss, and tirzepatide, which is a dual GLP-1 and GIP agonist, which goes by Mounjaro for type 2 diabetes and Zepbound for weight loss. While some of these medications are only FDA approved for treating type 2 diabetes, they are often prescribed off-label for weight loss. There are other formulations of these medications, as well as compounded GLP-1s, but our conversation will focus on these primarily since they are being used the most. So, what are GLP-1 medications and how do they work? GLP-1 medications were first approved to treat type 2 diabetes, and they can be very effective. GLP-1 improves glucose-dependent insulin release in the pancreas, meaning that it's an incretin. When blood glucose is high, insulin is released. This is great because there's a very low risk of low blood sugar with these medications. When blood sugar is low, insulin secretion is not affected. In fact, GLP-1s also suppress glucagon release. Glucagon is the hormone opposite of insulin that causes glucose to be released in the blood and can cause higher blood sugar levels. GLP-1s also help to prevent a blood sugar spike. They do this by slowing gastric emptying, which means that food stays in the stomach for longer, and they also slow intestinal motility, meaning that it takes longer to digest food. They also reduce appetite in the brain, so you feel less hungry and you end up eating less. GIP medication works by a different mechanism, but has a similar effect. So tirzepatide has an even greater effect and has some more benefits because of the dual therapy, because it has both GLP-1 and GIP. GIP medication enhances that glucose-dependent insulin secretion again. It also improves insulin sensitivity, specifically in fat tissue. And it actually does one thing the opposite of GLP-1, that it actually stimulates glucagon secretion during fasting or low blood sugar. So it actually can be even more protective of low blood sugar. In obesity and weight management, these effects are seen even more because they're at a higher dose. So because the side effects of weight loss were seen with the diabetes-approved version of the GLP-1 medication, pharmaceutical companies have come out with higher dose versions to treat obesity. Semaglutide, liraglutide, and tirzepatide have indications for weight loss at higher doses, and these medications go by the brand names Wegovy, Rybelsus, Saxenda, Zepbound. There's also a brand new oral medication on the market called Foundayo, which is orforglipron, and that was a new daily pill for weight loss that was actually just approved in April of 2026. The mechanisms for weight loss are similar to those with diabetes. GLP-1 improves insulin sensitivity, it slows gastric emptying, and it reduces the appetite. Specifically, its effects for weight loss occur in the parts of the brain that regulate food intake for pleasure and reward processing. This pathway may be a similar one that's responsible for GLP-1's effects in addiction and mental health, which we'll get into. GIP medication has receptors widely distributed in the brain, especially in the parts of the brain that help regulate energy balance. And that may explain why the dual action tirzepatide is so effective for weight loss. It can also help reduce nausea through some of the different brain pathways. And so even though tirzepatide can be more effective, it can actually also have fewer side effects in some people because of that reduction in nausea. There are other uses for these medications, including some FDA-approved claims. Some of them have cardiac benefits, kidney protection, reduction in sleep apnea symptoms, and can help treat metabolic fatty liver disease. There's also exploratory research being done for potential use in inflammatory diseases, substance use disorder, and neurodegenerative diseases. This is all very preliminary research, and there's a lot of studies going on now. So we don't have any specific claims, but there is a lot of interest for these medications being used in a wide range of different diseases. So these medications kind of sound amazing, but what's the catch? What are the downsides of GLP-1 medication? The most dangerous unintended consequences of the popularity of these medications is that they can mask eating disorders and actually cause malnutrition, which can have life-altering impacts, especially as people age. So while these medications hold great potential, I want to remind you that they are a tool, and in current practice, they're often being used inappropriately. These medications are meant to treat metabolic disorders. They're indicated for people with a BMI or body mass index of greater than 30 or greater than 25 with a weight-related comorbidity. These medications are not for losing, quote unquote, the last 10 pounds. And I think we've seen a huge uptick in quote unquote skinny culture and disordered eating. This is so prevalent that there are colloquialisms about the appearance of someone losing weight on GLP-1s. Maybe you've heard of Ozempic face, related to that quick weight loss and the muscle wasting. Even in people who meet the criteria for one of these medications, you still have to carefully monitor their nutrition. You can be in a larger body and still have malnutrition, resulting in muscle loss and bone loss, which can have long-term consequences for longevity. Additionally, we need to talk about what it's like in the trenches with GLP-1. At a high level, the results look incredible, but the day-to-day reality of someone taking a GLP-1 can be very different, and it can be either very positive or very negative. There are side effects which are known and expected based on the way these medications work. If those side effects are too strong, the dose needs to be adjusted. And that, I would argue, is why this current use is so dangerous. Many people are losing weight too quickly, which is what is causing the muscle wasting and malnutrition. Many people are on doses that are likely too high for them, but they don't have a monitoring and follow-up, and they don't have the right healthcare team. Some people are also going on or off again these medications based on insurance coverage or expense, and that can cause even more metabolic problems than they experienced before. There are also some big concerns around compounded medication and the safety of these. If you are taking a GLP-1 or GIP medication, you need to focus on nutrition and exercise to prevent the harmful side effects of muscle and bone loss. For calories, you need to be eating a minimum of 1,000 to 1,200 calories per day. Just because you're not feeling physically hungry does not mean that your body isn't starving. Eating less means that you will lose muscle, and the more restrictive the calories, the more muscle loss you'll have. You need to talk with your healthcare team if you cannot eat this amount. That likely means your dose is too high and you need to have it adjusted. For protein, you need to be eating a minimum of 1.2 to 1.5 grams of protein per kilogram of actual body weight per day. That equals about 20 to 25% of energy on a 1600 calorie per day diet, or a minimum of 80 to 100 grams of protein. Sometimes it can be difficult to calculate this amount, especially if you're in a larger body. So you really need to work one-on-one with a dietitian or a doctor to help you determine the minimum protein that you need today. And you all know how much I love plant protein for all of its health benefits, but you may need to consider some animal protein in your diet to make sure that you're getting that minimum threshold. You also need to be making sure that you're getting fiber, at least 14 grams per 1,000 calories, or at least 22 grams for a 1,600 calorie diet. And that has to do with preventing those symptoms of constipation and other GI side effects. We need to be making sure that we're keeping your gut healthy while you're losing weight. Focusing on hydration and micronutrients is also really important. Making sure that you're getting in at least 2 liters of fluid per day, which can seem like a lot when you're not hungry, and making sure that you're getting important micronutrients like vitamin A, D, vitamin B1, B9, B12, iron, calcium, and magnesium. While you're on a GLP-1, I highly recommend to minimize alcohol intake, primarily because this can displace a lot of other nutrients, and you've got to be focusing on getting enough of these foods. In addition to nutrition, exercise is so important with GLP-1 therapy. Not just cardiovascular exercise, the 150 minutes of moderate to vigorous activity, but especially strength training. You need to be adding in 2 to 3 times of strength training per week, because that is the only thing that will prevent any of that muscle loss. So the $1 million question that I'm always asked is, what happens when you stop the medication? To be honest, these medications are designed for long-term use. That's how they were first developed with type 2 diabetes, and that's how they're intended today. Currently, there are no validated, evidence-based tapering protocols for stopping GLP-1 therapy. There are a lot of ways that providers are trying to help their patients decrease or get off of these medications that are being tested out. Some of this is off-label dosing, like stretching the dose to every 10 days instead of every 7 days, or doing quote-unquote microdosing or smaller amounts of medication. There are anecdotes of people getting off the medication and staying off, but this seems to be the exception and not the rule. And that's because the benefits are reversed after stopping the medication. That when you stop the medication, you no longer see the mechanisms, and so you no longer see the effects. And this is indicated by research showing that 60 to 90% of weight is regained within the first year of stopping a medication. And people return to a baseline weight after an average 1.7 years. And unfortunately, this is true even if you're doing that recommended diet and exercise. I would liken this medication to treating the metabolic syndrome of obesity, similar to how we treat other chronic diseases like high blood pressure or cholesterol. If your doctor says that you need to take a medication for a cholesterol, you expect to take that cholesterol medication probably for the rest of your life unless something significant changes. If you stop the medication for cholesterol, you would not be surprised when your cholesterol ends up going back up. And that's the same thing that's happening with these GLP-1 medications, that if you stop the medication, then you'll stop the mechanisms and you'll stop seeing the effects. So if you are considering starting a GLP-1 medication, you need to be aware that this is likely a lifelong therapy similar to other chronic disease management, like cholesterol or high blood pressure medication. It's always possible to try and trial off of the medication, but if you start seeing your hunger come back or you're seeing these numbers go back in the wrong direction, then you need to have a conversation with your doctor about if you should trial back on the medication. There is even more to unpack in our GLP-1 conversation. So stick around after the break if you'd like to understand the nuance of how to apply this information about GLP-1 medications, including information about the additional uses, compounded medication, and considerations for taking a GLP-1 medication. I'll give you more nuanced, evidence-based information and provide some thoughtful questions for you to ask so you feel confident you're making the right decision for your body. Before we dig into today's topic, I want to share a quick resource in case you're thinking, okay, but how do I actually apply this in real life? That's exactly why I created my meal planning app, the Peas and Poppy Meal Guides. Each week, you get a flexible meal plan built around balanced nutrition and variety. You can adjust the meals to fit your preferences, and the app automatically creates your grocery list, so shopping is faster and easier. If you'd like help turning nutrition knowledge into real-life meals, you can try it for free at peasandpoppiness.com. All right, let's get into the nuance behind today's question. Taking a GLP-1 medication, like any medication, is an incredibly individualized, personal decision. But from what it seems like on social media, advertisements on TV, and people all around, it seems like they're everywhere. Before considering a medication, you deserve to know the potential risks and benefits, and that's what we'll discuss more in depth. If you're trying to decide if a GLP-1 is right for you, take this information to your healthcare team so that you can discuss your personal needs. I am not here to convince you to take or avoid a GLP-1, but rather to provide you with the information and food for thought you need to make an informed choice. We've already reviewed the most common FDA-approved GLP-1 medications, including semaglutide, liraglutide, and tirzepatide, which is the dual therapy GLP-1 GIP. Other FDA-approved GLP-1 medications include dulaglutide, which is Trulicity, and exenatide, which is Byetta and Bydureon. These are approved for type 2 diabetes and do have some weight loss, but not as much as the others mentioned. Historically, these medications have only been available as injections because hormones are delicate and subject to digestion. But recently, 2 oral pills have been approved: Foundayo, which is orforglipron, and Rybelsus, which is semaglutide. Then there are compounded GLP-1 medications. Compounded medications are mixed in a pharmacy or in an outsourcing facility by a licensed pharmacist or physician. Compounded formulations of medications are used for patients who for some reason cannot take the FDA-approved medication, such as an allergy to a dye or a need for a liquid instead of a capsule. Compounded formulations are sometimes also used if there's a shortage of the FDA-approved medications. That's when compounding formulations exploded for GLP-1 medications. Technically, these formulations are legal with a prescription from a licensed provider stating a reason that a patient cannot take the FDA-approved version. But in practice, there is relatively little oversight happening in many online telehealth practices and med spas. There can be a lot of risks associated with compounded medications, including poor compounding or patient mistakes with administration, resulting in too high or too low of doses of the active ingredient. Most people opting for compounded medications are now because of the cost. If insurance doesn't cover the medications, which can be quite expensive out of pocket, a compounded version is often cheaper. If you are considering a compounded GLP-1 medication, make sure to discuss the risks and benefits with your healthcare provider. Okay, but what else do GLP-1 medications do? We've already discussed the main reasons for GLP-1 use to treat type 2 diabetes and obesity, but there is interest in using GLP-1s for a variety of other diseases. And that's because GLP-1 receptor agonists are found all over the body, which means these medications affect many different systems. And we are still in the very early stages of learning how and what this means. GLP-1 receptors are found in the pancreas, GI tract, heart, kidneys, and multiple brain regions, such as the hypothalamus, amygdala, and hippocampus. GIP works in other ways on insulin secretion and lipid clearance. This means that there is potential for wide benefits seen in multiple systems throughout the body. Let's start with the best research, the FDA-approved claims, most which are seen in patients with type 2 diabetes because that's the population where these were first studied. Different medications have different indications. So make sure to discuss with your healthcare provider which type might be right for you. For example, semaglutide has a lot of cardiovascular data behind it. In terms of heart health, some of these medications reduce the risk of major cardiovascular events in type 2 diabetes. Those medications include liraglutide, semaglutide, dulaglutide, and tirzepatide. They saw a significant reduction in heart attack, stroke, and cardiovascular death. The mechanism appears to be multiple ways. First of all, these medications reduce inflammation as measured by high sensitivity C-reactive protein and interleukin-6. They also improve blood pressure improving cholesterol by reducing LDL, VLDL, triglycerides, and chylomicrons. And they also seem to impact the blood vessels themselves, as well as smooth muscle cells and blood cells. And of course, these medications reduce A1C, treating diabetes, and weight. All of these together have a marked benefit for cardiovascular health. Another FDA-approved claim is related to kidney disease, specifically in patients with type 2 diabetes, both with and without chronic kidney disease. They saw a reduction in kidney decline in this population, as measured by eGFR decline, kidney failure, and death from kidney-related causes. In fact, GLP-1 medication appears to prevent chronic kidney disease in people with overweight or obesity. And these benefits extend beyond what you would expect to see with the reductions in blood pressure and weight. So these medications appear to be acting directly on the kidney in a protective way. Another FDA-approved claim is related to fatty liver disease, or non-alcoholic steatohepatitis, or a newer name, metabolic dysfunction-associated steatohepatitis. This is fat on the liver that is not related to alcohol intake, but rather because of a metabolic dysfunction. Again, these medications appear to work directly to reduce fatty liver disease in ways that are beyond what we would expect to see with the weight loss we see. Finally, there seem to be benefits with obstructive sleep apnea. Specifically, tirzepatide is FDA approved to treat sleep apnea. In the studies, they saw 40 to 50% of patients saw a significant reduction of sleep apnea symptoms. They saw so much reduction that treatment with CPAP would actually no longer be necessary. GLP-1 only also improves these sleep apnea symptoms, but not as much, and the medications are not technically approved for FDA use. So whether you're on tirzepatide or one of the GLP-1 only agonists, you may see a reduction in sleep apnea symptoms. The mechanism for this is probably primarily the weight loss. Specifically, losing weight under the tongue can reduce the obstruction when breathing. So these can be pretty significant, very impactful changes for people. You can see why there is so much excitement in the medical and public communities for these medications. There's also more off-label uses and research potential for many other diseases. Some diseases include neurodegenerative diseases like Alzheimer's or Parkinson's. Unfortunately, there's some variable research. Specifically with Alzheimer's, there's been a lot of excitement about using GLP-1s to prevent or slow Alzheimer's disease, but a recent study published in 2025 unfortunately showed no signs of slowing the disease progression. They did see some improved markers in other areas, but technically no slowing of the disease progression. In Parkinson's disease, there's some variable results, and both of these are in the very early stages of research. Another area of interest is in treating substance use disorder, specifically alcohol use disorder, nicotine use, or some other substances. There are a lot of studies going on right now to see if this could be impactful. Their thought is that this is related to the reward pathways in the brain, and these might work in a similar way to the appetite control related to the food pleasure centers. Another area of interest is in inflammatory diseases, including inflammatory bowel disease, psoriasis, rheumatoid, and psoriatic arthritis. Additionally, in PCOS, in possible cancer prevention, and even in type 1 diabetes. So I'm not going to go into these because there's such preliminary research, but because the receptors are all over the body, these medications have the potential to act in so many different ways that seem very exciting. We may not be using doses as high as what are needed for weight loss, but potentially even microdosing or small doses could have an impact in these different, very significant health concerns. These medications are actually also being used in children. Semaglutide specifically is approved for children ages 12 and up, but I want to say that you should use extreme caution if you are thinking about using this in children. This is a prime time for growth and for laying down bone, and so there is a high risk of both malnutrition and eating disorders. I would suggest that this probably should not be first-line therapy. If you're a parent and you're concerned about your child's weight, please see a pediatric registered dietitian trained in eating disorders or disordered eating. But at the end of the day, you need to, of course, do the risk-benefit analysis on an individual basis. If you have a child who has these metabolic disorders, then the benefits in metabolism may be worth the other potential risks. But this really needs to be decided on an individual basis, and you need to be working with your qualified healthcare team. This brings me to what I call the dark side of GLP-1 medication. There are a lot of potential benefits, but like everything else, there's always multiple sides to a story. There are both acute side effects and long-term consequences of GLP-1 therapy to consider. Before deciding whether or not to consider a medication, here are a few questions to consider. What is my goal with taking a GLP-1 medication and why? What is your plan to support your body while taking a GLP-1? What happens if the GLP-1 doesn't work? What if it has too many side effects? Who should be on your healthcare team and how often should you see them? And what is your long-term plan with taking a GLP-1 medication? Let's dive into the why, which is always where I start conversations with one-on-one clients, because so often what we think we are treating is actually different than the underlying need. Obviously, there are many uses for blood sugar control, for weight loss, for cardiac and kidney benefits, for sleep apnea, and more potential uses. But I'm going to focus on the most popular and potentially most problematic reason for the use of GLP-1s, food noise and weight loss. What is food noise? People talk about this all the time. There was a study in 2025 that tried to give this a definition, and they defined food noise as persistent thoughts about food that are perceived by the individual as being unwanted and or dysphoric and may cause harm to the individual, including social, mental, or physical problems. The cause of food noise can be multifactorial. If you're experiencing food noise, which is basically thinking about food all the time, ruminating about food, it gets in the way of what you're trying to do. It's so noisy and overwhelming. There can be multiple reasons for that. One reason could be psychological. These food noise thoughts can come from restrictive dieting. For example, if you're on a diet that says that you can't eat bread, it's likely that you're going to think about how you want to eat bread and think about bread more. Sometimes getting rid of dieting using a tool like intuitive eating can help you to reduce that food noise and bring it back to a normal level. But food noise can also be physical. It can come from your energy needs. Like if you're hungry, you're going to think about food more. Or it could come from altered metabolic hormones, which can happen when somebody has a metabolic adaptation to weight loss. When someone loses weight, each subsequent time you try and lose weight, it gets harder. Maybe you have experienced this yourself, that you went on a diet the first time in your 20s and it was easy peasy. You lost weight, no problem. But then you regained the weight. And the next time you tried to lose weight on a diet, it became a little bit harder. The next time was harder. And the next time was harder. This is not in your head. This is actually a physiological adaptation to weight loss. Your body changes the hormones to help your body stay at a higher weight. You increase the hormone ghrelin, which is a hunger hormone, and you decrease satiety hormones, including peptide YY, cholecystokinin, GLP-1, insulin, and leptin. If you have weight cycled many times over your life, lost weight and regained it, then in order to maintain a weight loss and stay at a lower level, you likely will feel hungry. That can show up as food noise. So I want to note that when you are treating food noise, you need to match the cause with the correct solution. If the food noise is coming from a psychological reason, you should treat it with intuitive eating. Food noise is very common because of diet culture, which diet culture is basically a set of myths and expectations around food and weight, which typically equates thinness to health and categorizes food as good or bad. This food noise can come from ignoring hunger cues, having extreme rules around food. So I always recommend to start this conversation with intuitive eating, because you need the skills to be able to understand your hunger, fuel your body appropriately, and not have this psychological restriction. But if intuitive eating isn't working, then maybe the problem is not restrictive. Maybe the problem is physical. And that's when we could explore medication options. it can be difficult to measure this. And so you can consider measuring something like insulin sensitivity with a lab value called HOMA-IR, which is basically a calculation of your glucose and your insulin to see how effective your insulin is working. But even this measure is tricky. So figuring out if this food noise is coming from a psychological place or a physical place, I would suggest that you need to work with a certified intuitive eating counselor, maybe even a therapist, to work through body image and unpack the reasons for wanting to lose weight. A dietitian can help you understand what food is for and how to properly nourish your body. Because I also want to say that if you're not getting enough protein or fiber or calories, you are probably always going to have food noise because you're not going to have as much satiety if you're not meeting your actual needs. Related to food noise, the other very common reason for using GLP-1s is weight loss. And if this is your reason, I really want to encourage you to ask questions about why this is. Do you really need to lose weight? And I want to emphasize that weight does not necessarily equal health. The FDA approved uses for GLP-1s for weight loss don't start until the weight at which someone is technically obese. And so we're seeing these used at a much lower weight than what is actually necessary for health. And you can be in a larger body and be metabolically healthy. You can also be at a normal weight body and be metabolically unhealthy. And I really want to point out that being underweight is actually very dangerous. Your overall mortality risk, which is your risk of death, goes up significantly when you are underweight. And this is something that's not talked about very often at all in our culture. In fact, skinny culture really promotes undereating and underweight. We pretend that being thin is being healthy, but that is not true. Additionally, did you know that only 6% of people with an eating disorder are medically underweight? That means that you cannot tell by looking at someone if they struggle with an eating disorder. And there is a high likelihood that many people in larger bodies who are losing weight with a GLP-1 may be struggling with an undiagnosed or untreated eating disorder. Weight loss for a person with an eating disorder may be more damaging than the potential benefits of weight. Weight loss is not always healthy. And when we talk about weight, we need to be honest about what it really is that we want versus what we think weight represents. I like to think of weight as a secondary measure of health. Weight is not something that you can directly change, and nor is it probably your desired outcome. What you can change are primary drivers of health. Some of these we can't, like things like genetics or environment, but you can change things like your eating pattern or your movement. Other secondary measures in addition to weight include examples like blood pressure, cholesterol, hormone levels. Those secondary measures are not our goal, but they can affect our goal. What I really want you to get at is, what is your desired outcome? What does weight mean to you? If weight isn't your actual desired outcome, what is it? Is it acceptance? Is it a feeling of love? Is it confidence? Is it longevity and health? We need to be really clear about what the desired outcome is so that we can get there in the best and most appropriate way possible. So if your desired outcome is health, I want to suggest that your health may benefit from weight loss, but it is more nuanced than that. There can be unhealthy weight loss, and the risk for weight loss for you may outweigh the benefits of weight loss. And again, weight does not equal health. Normal weight can be metabolically unhealthy. Overweight can be metabolically healthy. Weight is only one measure of health. You need to look at and control other measures such as blood pressure, cholesterol, etc. Weight cycling is also potentially more dangerous than maintaining a high weight. So you really need to make a long-term plan when it comes to GLP-1 medication. It's much more effective and much more important to get off this weight loss roller coaster than it is to just lose weight at all cost. So if this is a body image issue, which many times it is, and for good reason, because we have a lot of fat phobia in our society, It's really important to work with a licensed therapist, a dietitian, a certified intuitive eating counselor, or other qualified healthcare professional who can help you work through some of these underlying reasons for what you really may be seeking. My message is that you really need to get clear on your reason for taking a GLP-1 and make sure you're treating the right problem. GLP-1s can mask the actual underlying problem, which could be the need to make peace with food and properly supporting your body. You may hear this and think that you would benefit, and you may still benefit from doing underlying work with a therapist, dietitian, or health coach about some of these desired outcomes and what weight loss signifies and means to you. So the question to ask yourself, is GLP-1 actually treating the block that's keeping you from getting to your goal? If you decide that the answer is yes, that you want to try a GLP-1, let's talk about how to properly support your body. You need adequate calories, protein, fiber, and micronutrients. Too much weight loss too fast can be very detrimental in the long run. It can cause muscle loss, bone loss, and general malnutrition, like, for example, your hair falling out because you're not eating enough protein. And just because your appetite is reduced and you don't feel hungry does not mean that you don't need to eat. Just because you are in a larger body does not mean that you shouldn't eat. No matter your weight, you deserve nourishment. This is the most alarming thing that I see, is that there is too much reduction in appetite, or someone is using a GLP-1 as an excuse not to eat. I have literally seen individuals who have so much appetite suppression that they report only eating one avocado for the whole day. You guys, Holocaust survivors in concentration camps were fed more than that. We are talking about starvation level intakes that are being normalized. You will still be malnourished if you don't eat, even if you're not hungry, even if you are in a larger body. If you're on a GLP-1 medication, you should be aiming for slow, steady weight loss, about 1 to 1.5 pounds per week. Honestly, the slower the better, because you will be able to retain more muscle. Weight loss varies, and in your journey, some weeks you'll lose more and some weeks you'll lose less. At first, you'll likely lose more weight because you're losing some water that you've been retaining. That's normal. And so don't be too frustrated. Don't feel like you need to go up on your dose too quickly if your weight loss slows down. I already reviewed those nutrition goals, so go back to the beginning if you need a reminder of the minimum calories, protein, fiber, etc. Additionally, don't forget about exercise. Muscle is only stimulated when you are exercising. You need adequate protein, but protein alone will not prevent muscle loss. You have to be doing some strength training. I would recommend that you consider measuring body composition in addition to weight if you are on these medications. And some doctors' offices will help you do this and help you monitor to make sure that you're not only losing muscle, but that you're losing the type of weight that you want to do. So what if you take a GLP-1 and it doesn't work? My first question is, of course, what do you mean by not work? And this is why it's so important to identify your actual goal. Because the truth is, if you can never be thin enough, that is body dysmorphia. And that can only be treated by working with a licensed professional. So really exploring what it is that you want out of weight loss, or what it is that you want out of these medications, is so important. And you need to discuss this with your healthcare provider. For example, what are you going to do if your goal is to control blood sugar and your blood sugar is not changing? You might need a different type of GLP-1. Some of these different medications work in different ways. You might need that dual therapy GLP-1 GIP, or you might simply need a higher dose. So this is why monitoring and following up with your healthcare team is so important, so that you can understand how to measure if something is working and then what to do if it's not. But on the flip side, what if your GLP-1 is working too well? What if it has too many side effects? Side effects are one of the most common reasons that people stop these medications, and the discontinuation rates are very high on these medications. As much as 60% of people discontinue use in the first year who are not taking this for diabetes. And remember that that can be a real problem, because it can put you back on the weight loss roller coaster and you'll lose the metabolic effects. The same mechanisms that are providing a lot of the benefits can also cause the side effects. And that's especially true when the dose is too high for an individual. The most common side effects are related to GI side effects because of the delayed gastric emptying and the slowed intestinal motility. These include nausea, vomiting, abdominal pain, diarrhea, constipation, bloating, and gas. These symptoms usually show up when you're first starting the medication, especially if you're increasing the dose too quickly or if you started at a dose that was too high. The severity can vary widely. And sometimes I would argue that this is an indication that you need to decrease your dose, and that's why you need to be in constant contact with your doctor. So if you are experiencing these side effects, don't stop cold turkey. Please call your doctor and talk about what you can do. There are some other side effects like headache, fatigue, and dizziness, obviously decreased appetite, hair loss, injection site reactions. Again, some of these are expected, like the reduction in appetite, but if you don't have any appetite, you need to adjust the dose. The hair loss also could be a sign of malnutrition. So keep in mind that these are not necessarily should be side effects of the medication, but maybe are a side effect of the medication of you not eating enough. Other serious side effects are rare, but you need to discuss your individual risk with your healthcare provider. If this medication is working quote unquote too well and you have no appetite or extreme nausea, you may need to decrease your dose, increase the titration more slowly, or try a different type. Do not power through. You need to contact your healthcare provider to make sure that you are getting adequate nutrition and support in your body. You've really got to plan for frequent communication with your healthcare team, especially when you first start these medications, because there are solutions. Remember that tirzepatide, the GLP-1 GIP combo, has less side effects. There are anti-nausea medications that you can take, and there are a lot of dietary ways that we can address this in the first place. So let's talk about this. Who should be on your healthcare team and how often should you see them? First, you need a prescribing healthcare provider who knows you, your medical history, and is educated in GLP-1 therapy. I want you to beware of off-site prescribers who don't know you or bother taking a medical history. It is wild how you can go online, answer a few questions, and have an off-site prescriber who's never seen you prescribe these medications. I really encourage you to work with your doctor or work with a weight loss clinic that specializes in these medications and has a team to support you. Secondly, I recommend highly that you have a dietitian on your team who can help you make sure that you're getting adequate nutrition. You might not know what you don't know. And if you've had a long history of dieting, I find that many people have ideas about healthy eating that aren't necessarily true. I've worked with clients who feel scared of healthy foods like nuts or avocados because they know that they're high in fat. But these are actually really nutrient-dense foods that we should be including. So working with a professional is really important. And I don't mean a social media dietitian. I mean a dietitian in person who is asking you questions about how you feel and who knows your medical history. Working one-on-one with somebody is really important. Thirdly, I would encourage you to consider someone to help you with the psychological impacts of these medications. A therapist, a body image coach, a health coach, an intuitive eating counselor. Work with somebody who can help you with the psychological impacts of weight loss, of unpacking what that means. Because in our culture, weight is not just weight. Weight has huge implications for how people treat you, how you think of yourself, and honestly, even what kind of medical services you're able to access. Unfortunately, because of fat phobia, people in larger bodies have a different experience. And if that is you or has been you in the past, then you've got to work through that. And having a licensed professional can be very helpful. The last, but possibly one of the most important questions is, what is your long-term plan with taking a GLP-1 medications? Because remember that these medications are designed for long-term use, but the data show that many people are not using them as indicated. Within 1 year of starting a medication, about 45% of people with diabetes stop taking them, and about 65% of people without diabetes stop taking them. And remember, when you stop the medication, you stop the mechanisms and the results reverse, meaning that we see weight regain and increased risk of metabolic diseases. So for the person who is frustrated with weight cycling, short-term GLP-1 use may be making the problem worse. And remember, there are not specific guidelines for coming off the medication. What we do know is that you should not stop cold turkey. You may be able to titrate your dose down or experiment with increasing the length between doses, but that is something that you have to work with one-on-one with your healthcare provider because these are off-label uses. I would think of this medication the same way that you do for other diseases, like high blood pressure, cholesterol, or glucose control. You stop the medication, you stop seeing the benefits, and the numbers go back to what they were before. So if you're thinking about starting, you need to at least be psychologically prepared for lifelong therapy. And this includes the financial aspect. Do you have a plan if your insurance changes or your financial status changes? These all can really impact your overall health, and so you need to be prepared for them. Whew. That felt like an emotional roller coaster. Let's bring it back to what I would actually do if I were personally trying to navigate the GLP-1 landscape. Number one, I would get really clear on my goals, and I would work with a licensed therapist, an intuitive eating counselor, or a certified health coach to do this. Remember that GLP-1 medications do not treat the emotional and psychological components related to food and weight. And you are going to need to do this work at some point. Doing it before going on a GLP-1 will serve you so much better in the long run. Number two, if I were to decide I wanted to pursue a GLP-1 medication, I would find a healthcare team who I trust, who has experience with GLP-1 medications, and I would plan to see them regularly. This would include a prescribing provider who would listen to me, and preferably one who would measure body composition. It would include a dietitian, specifically someone who is experienced in working with patients on GLP-1s, and it would include a therapist, body image coach, or intuitive eating counselor to address the psychological component. I would ask all of my questions to the team, and if I wasn't satisfied with the depth or the quality of the answers, I would go find someone else before starting the medication. If I were taking a GLP-1 medication, I would focus a lot on my nutrition and exercise habits. And honestly, I would not start this medication if I didn't have the mental space to do that piece as well. I would probably track my food intake, at least at first, to double check that I'm getting enough calories, protein, and fiber. I'd work with a dietitian to help me to learn more, to eat more intuitively by tuning into my hunger and fullness cues. And I would not start a GLP-1 if I couldn't commit to exercise. At minimum, strength training 2 to 3 times per week and some type of cardio for 150 minutes per week. Those are foundational for long-term success. I would also only start the medication if I were willing and able to stay on it for the long term. Once I were meeting my health goals, I would work really closely with my healthcare team to trial decreasing the dose, spreading out the dose, or coming off of it completely. But I would be aware of the potential need to restart or to stay on the medication for the long term. Finally, I would give myself so much grace. I would be overly honest with my healthcare team about the good, the bad, and all the in-between. I would talk to myself with kindness, as if I were talking to a friend. There is so much to consider in this conversation. If you want a safe place to ask nutrition questions with evidence-based answers and engage with a supportive community, that's exactly what I created in the forum of the Peas and Hoppy Meal Guides app. All members have access to this forum, and you can join for as little as $24.99 per year. It's not a place for individual recommendations for those you need to work one-on-one with a dietitian, doctor, or other healthcare provider. But inside the forum, this app is an alternative to Google and social media. It's a closed community where I am personally monitoring every post. We're sticking to facts, not fear. If you want to try it out, you can choose your membership level at peasandhappiness.com. Get in there today and ask your questions. Thanks for listening to Nutrition Nuance with Dietitian Ann. If this episode helped you cut through some of the nutrition noise, I'd love it if you shared it with a friend or family member who might find it helpful too. And if you're looking for practical ways to apply what we talk about here, especially when it comes to planning balanced meals for real life, you can learn more about my meal planning app at peasandhappiness.com. Remember, nutrition isn't one size fits all, and you are the expert of your own body. I'll see you next week for another episode of Nutrition Nuance. The information provided in this podcast is for educational purposes only, directed at healthy adults, and is not intended as medical or nutritional advice. It does not replace consultation with a qualified healthcare provider or registered dietitian. Individual needs vary, and you should consult your own provider before making changes to your diet, especially if you are under the age of 18, are pregnant, nursing, have a medical condition, or take medication. The hosts and guests are not responsible for any actions taken based on this content. For questions, concerns, or ideas for other episodes, email us at podcast@peasandhappiness.com.